Hi, my name is Megan Douglas. I would like to thank the ARCS Foundation reviewers for considering me as a semi-finalist for the ARCS Foundation Scholarship. Blood contacting devices are instrumental for life-saving medical procedures such as open heart surgery, stenting, and hemodialysis. Though extensive research has gone into developing these devices, two clinical complications still occur: device-induced clot formation and infection. Once introduced to the blood, manifestations of device-induced clotting can occur spontaneously and abruptly. Clotting can lead to device failure, obstruction of blood vessels, pulmonary embolism, heart attack, or even stroke. Even more, the CDC estimates that 1 in every 31 patients contract a healthcare-associated infection, and roughly 50% of these infections are related to medical device use, resulting in 100,000 deaths per year in the U.S. In order to prevent clot formation, all procedures involving blood contacting devices need systemic anticoagulation. However, this requires a careful balance between over and under administration of anticoagulants to prevent clot formation and uncontrolled bleeding. The clinical standard for fighting infection is the use of antibiotics, but the emergence of antibiotic resistance and biofilm formation, which needs 1,000 times the dosage of antibiotics, has made treating infection increasingly difficult. The CDC estimates that every year in the U.S., 2 million people contract antibiotic-resistant infections and 23,000 die as a result. In order to avoid the need for both systemic anticoagulation and antibiotics, our team has fabricated nitric oxide-releasing medical devices. Nitric oxide, or NO, is a key messenger in the body that has many different roles, including reducing platelet adhesion and antibacterial activity. The surfaces of medical devices are ordinarily fouled by the adhesion of platelets and the attachment and proliferation of bacteria, ultimately resulting in clot formation and infection. By using nitric oxide donors, our technology renders materials antibacterial and anti-clotting. Metal nanoparticles interact with NO donors impregnated in our materials, resulting in a catalyzed NO release. My research will focus on combining NO-releasing materials with metal nanoparticles to reduce the rate of infection and clot formation. I plan on exploring the effects of different metal nanoparticles on NO release for both short and long-term exposure, and the efficacy of this combination on antiplatelet and antimicrobial properties in both laboratory and clinical settings. I propose that this simple, low-budget surface modification will exhibit superior blood compatibility and antibacterial properties for biomedical devices used for vital, life-saving procedures. My goal is to reduce the morbidity and mortality rates associated with device-induced clot formation and infection while reducing global healthcare costs. Thank you.